Men are much more likely to die from COVID-19 than women. This is true globally, where the death rate has been about 50% higher for men. Notably, this gap doesn't appear to be explained either by differences in number of confirmed cases or in pre-existing conditions. By the end of last August, for example, in the US, over 65,000 more men have died from COVID-19. 362,000 male deaths compared to around 296,000 female deaths. But a new study conducted at Harvard University sheds new light on what the reason for the gender disparity may be. For more on that, we're joined by Professor Zvika Granot. Thank you very much for being with us today.
I'm happy to be here. So I looked at this study, and the U.S. is far larger than Israel, and obviously there's a lot of people and different states, and these states have they're different. And indeed, they saw that except for two states where the women death toll was higher than that of the men's. It seems that in most states, men do in fact die more of COVID than women.
Let's take, can you tell us a little bit about the numbers here in Israel? Do they actually confirm the same result that we see elsewhere in the world? Are there more deaths of men here over women?
Yeah. So if you go to the Ministry of Health dashboard and you can play with the graphs, I wasn't aware of it until about an hour ago. I went over and I looked at the numbers, and indeed it seems that men do in fact die more of COVID than do women. However, the difference in it's measured in percentage, is not that robust. If you look at the ages of 49 to 60, then there was 17% versus 15% men versus women of the entire death toll. So men do in fact die more, but it's not a real reason for concern because the difference is not that huge.
17% sounds quite a lot to me, but let's put that aside. The study suggests that it's not so much genetic tendencies, but behavioral attributes that cause the disparity. What sort of things are we talking about?
Right. So when they looked at the gender, they saw the differences, and then they tried to find other things they can attribute that would explain the differences. And when you look at economic state and the kind of work and the nutrition, then you start seeing how these graphs tend to get reasonable explanations. So you see that states where for example, they're known to have worse nutrition. The population consumes, for example, more junk food, then you see that men are more likely to die than women. Perhaps because men consume more junk food than women in these states, that's not really clear. This study really needs more investigation, but it's not just because these are men. There's a lot of environmental issues that contribute to these differences.